myocardial infarction, cardiac disorders, which is HCC 83, 82, 81 in a group ICD-9 code 412, which doesn't need any dots or zeros, is old myocardial infarction, which many people have. Many people have had minor heart attacks, survived them, don't even know it, and the provider will find this, and this turns into ICD code. That's an I 25.2, and then this is the least severe of the group. And remember, 83, the AMI is acute myocardial infarction, and this will probably be in 81. It was the first episode. And remember, EKGs, they have ST segments. So if the ST segment is elevated, it's a STEMI. If it's not elevated, it's a non-STEMI. And embolism, occlusion, rupture, thrombosis with infarction is a myocardial infarction. Heart attack is. Infarction is a key word. 83 is more for old myocardial infarction, not acute. So acute myocardial infarction, ICD-9 code 410 whatever. So the fourth digit indicates which wall of the heart was affected, and the fifth digit indicates episode of care. So then acute myocardial infarction 410.01 would be the 0 is the anterior wall, and the 1 is initial episode of care, and I believe this would go to 81. And so for 10.01, initial episode of care converts to I21.09. This is for ICD-10 code, and it is a STEMI because it is ST elevation, myocardial infarction, other coronary artery of anterior wall of the myocardium. That's on the hierarchy. This is an example of the wonderful things done with medical coding. So, and unstable angina in ICD-10 is going to be I 20.0, and there's a different names for it. Intermediate coronary syndrome, worsening effect, mortality data between 1999 and 2007. There were 550 deaths in the United States from this. Underlying cause of death of the data broken down. How interesting. Plain old angina doesn't mean much. It's could be pectoral, muscle, GERD, G-E-R-D, gastrointestinal reflux disease. Lots of things cause chest pain. But unstable angina is the true cardiac one. Chest pain unspecified, ICD-9 786.50, doesn't map to any hierarchy. So a conversion of 786.50 to ICD-10, R like Robert 07.9, and again, as far as Medicare hierarchy goes, this is a dead end. No pun intended. Specified heart arrhythmias, a strange word. So we're looking at, yes, those are S's. SSS, 6 sinus syndrome, complete heart block, AFib. Yes, AFib. Sinoatrial node dysfunction are all chronic conditions. And history of is a good reference. Dysrhythmias that don't count, like first degree block, second degree block, there aren't total heart blocks, don't count. If someone's paced, doesn't count. If they have tachycardia, plain old tachycardia, doesn't count. If it's paroxysmal, then it does. And if they have plain old bradycardia, it doesn't count. But if they're so bradycardic that they need to be paced, then once again we're at a impasse where they'll be covered by Medicare, hopefully. Back on under HCC 426.0, which is complete heart block, atrial ventricular block complete. It coded to I44.2, a type of complete heart block. Okay, so the 426.0 converted nicely, and then the 427.0 and 1, they convert maybe. And I'm doing this for practice, and it's just going to be like the Beatles song, like I said in one of the first videos, it's helter skelter. Alright, so 427.2, paroxysmal tachycardia, NOS, must be stated as paroxysmal. 427.31, atrial fibrillation. Then 427.32, atrial flutter. And 427. I did it wrong. I drew a 5, I shouldn't have. So it's 427.81, sinoatrial node dysfunction. And these are all going to map to HCC92, specific heart arrhythmias, otherwise known as dysrhythmias. 427.2, paroxysmal tachycardia, stated as paroxysmal. ICD-10 is I47.9. 427.31 AFib is a I48, that's about 8.91. And then 427.32 atrial flutter maybe converts to I48.92, is said approximate. And then 427.81 sinoatrial node dysfunction coded to a couple things, two, which is I49.5, which is sick sinus syndrome, and R00.1, which is bradycardia unspecified. 427.1 paroxysmal ventricular tachycardia approximately converts to I47.2.